Good evening. I'm Dr. Robert Peppercorn, and this is the Medical Explorer. As a specialist in skin cancer, cosmetic laser surgery, liposculpture, and allergies, and as host of this program, I'll take you on an exploration of the medical communities of our Northern California counties and bring you behind the scenes of medical care practices right here in our local areas. Tonight, the Medical Explorer is pleased to continue our exploration of the ultra-modern radiology equipment that is brought to us by the doctors of Sutter Buttes Imaging here in Yuba City. This evening's program will focus on new breakthroughs in CT scanning technology that is improved on the already state-of-the-art diagnostic technique called computerized axial tomography. The new GE Lightspeed CT scanner at Sutter Buttes Imaging is so modern and fast that it can scan an entire brain in just a couple of minutes. Imagine how fast it could scan a whole body. It's painless and it's non-invasive. We'll have the chance to explore behind the scenes and watch an actual scan being done on a very well-known mystery patient tonight. In the pharmacy corner this evening, our award-winning neighborhood pharmacist Bob Church will tell us about the increasingly popular area of healthcare that involves the use of herbs in medical treatment. Have you wondered about the safety of herbs such as garlic, ginkgo, ginseng, and others? Well, we'll learn the answer to more about herbs and their interactions with other medications and drugs in the pharmacy corner this evening. Tonight's program will be extremely timely and informative, and I hope that you'll stay with us for the next half hour. Before getting to our topics tonight, let's take a look at the latest medical news. For the first time in their lives, psoriasis sufferers have a real hope for relief from unsightly and sometimes painful skin lesions without the need for messy creams or lotions, thanks to a revolutionary new laser treatment. Using a carefully focused beam of light delivered through a sophisticated fiber optic device, the Extract Excimer laser can help treat psoriasis quickly and effectively without exposing healthy skin to potentially harmful ultraviolet rays. Individuals with psoriasis can often obtain relief in just 4 to 10 sessions. Most treatments last only a few minutes, and relief can often last for many months. Psoriasis is the second most common skin disorder in the United States and is estimated to affect 7 million Americans. The disease can show itself at any age and usually appears as red, scaly plaques that start on the elbows or the knees. These flaky areas of skin can progress to cause patches anywhere on the body, and there's a great tendency for the condition to cause severe dandruff, redness, and flaking on the scalp. Many patients experience discomfort, disfigurement, and embarrassment. In severe situations, social withdrawal and even depression can occur. The new Extract laser offers a major breakthrough for patients with mild and moderate psoriasis, since only 4 to 10 treatments are required for clearing in most patients. The pinpoint beam of the Extract laser only treats the individual skin lesions. Thus, normal skin does not have to be exposed to the ultraviolet rays. During treatment with the Extract laser, psoriasis sufferers do not need to apply medicated creams or lotions. On the first visit, the dermatologist will perform a test to determine the optimum dosage level for the patient's skin. The day following the test, the patient returns to begin treatments. Treatments involve having the Extract laser technician move the laser handpiece over the affected area, painting it with the laser light. Depending on the size of the lesion, it takes only a few minutes. Although results do vary from person to person, relief is often obtained in just 4 to 10 brief treatment sessions, about 2 treatments per week. Many people see results with just 1 or 2 treatments. Although the Extract laser is not a cure for psoriasis, many patients achieve clear skin for many months. If you're interested in the new laser treatment for psoriasis, just give us a call here at the Advanced Dermatology and Laser Center at 671-4182 in Yuba City. That's 671-4182. It's now time for us to visit our pharmacy corner as we learn the latest up-to-date information on the world of drugs, medications, and other materials that people use for their health care from one of our area's most respected neighborhood pharmacists. Returning tonight in our pharmacy corner is our award-winning registered pharmacist, Bob Church, from the Medicine Shop Pharmacy in Marysville. Bob, welcome back to the Medical Explorer.
Thank you very much.
How big of a problem is herbs and drugs mixing together and causing problems? That's something I'm not really familiar with.
Well, it used to be something that I wasn't familiar with and that I really wasn't concerned about. But as you know, in 1990, this whole herb vitamin thing changed when legislation was passed to reclassify all those products as dietary supplements. Since that time, the use of those types of products has just become astronomical. It's somewhere in the neighborhood of $2 to $3 billion a year in sales in this country, and it's incredible. It's not something that's going to go away. It's here to stay. It's estimated that about 1/4 of our population now uses vitamins and herbs in conjunction with one or more prescription medications.
Fascinating.
The real problem with that is, even though that's an astronomical number, about 40 to 70% of those people will not tell their physician or their pharmacist that they're using those products. It's like there's a mindset in this country that those are not drugs, so you don't need to talk about it.
Right.
So many times I ask people, what other medicines are you taking? And then I'll say, well, are you taking any herbal products or vitamins? Oh, well, yes, I'm taking this and this and this and this. But they don't include it when I ask them, are you taking any other medicines or drugs?
A lot of medicines even come from plants and herbs, so
absolutely
they don't realize it's a medicine too.
Yes, so I think this is a big area now, a very big area that has to be addressed.
Is there scientific data about these things, drugs and herbs and reactions?
Probably about as much as there is on the actions of the herbs themselves, which, as you know, is not much. And when you try to access data, you have to be very, very selective, because so much of that data out there is written by people who have a personal interest in selling a product. So you have to be somewhat of a detective. The information on herb and drug interactions is becoming more and more widespread now, much more available, because things are starting to be coming up and people are chronicling them in and putting them into some sort of form where you can retrieve them. But I think because of the use of these products and the fact that the data is still limited, it behooves every physician and pharmacist to make sure that they continue to educate themselves on these products and the interactions, because I'm seeing that it's having an effect, and a serious effect in certain instances. It's not something that we can ignore anymore.
Right. Well, why don't we get right into some specifics about herbs and uses and things.
Okay.
Can I just ask you some? Is that all right?
Absolutely.
What about garlic? I hear commercials. Larry King talks about taking garlic on CNN or something.
Absolutely.
What about that?
Okay, garlic is a drug which most people are taking to help lower their cholesterol and their high blood pressure. And there is some data that garlic is effective in doing that. Certainly not as effective and determinable, the result, as if we use some other drugs. But there is data to support it. Problem with garlic is if people are taking Coumadin to help thin their blood, they have to be very, very careful when they add or decrease garlic from their drug regimen.
Okay.
Because it will potentiate the effects of the Coumadin, which will mean that your blood will become thinner than what your doctor wants it to be. So it's very important that you have those pro-time INR blood tests done on a regular basis to make sure that if your Coumadin levels have to be adjusted, they can do so. Another key point is people who are diabetics using either insulin or oral anti-diabetic medications to lower their blood sugars have to be careful because garlic in itself can have a blood sugar lowering effect, which then can potentiate the medications or the insulin that you're already using, so there may have to be an adjustment in those medicines. Usually people who are conscientious about their diabetes are doing blood testing anyway at home, so that should show up, but they need to know that if there's a decrease, that they need to let their physician know about that.
What about another one I hear about, ginkgo? Is that how you pronounce it?
Yeah, ginkgo. Ginkgo is used a lot for memory loss, dementia problems. A lot of people using ginkgo. Ginkgo is a potent inhibitor of platelet activating factor, which is one of the factors in the normal progression of blood clotting. So if you're using ginkgo in association with drugs like aspirin or anti-inflammatory pain relievers, anti-platelet aggregating drugs like Plavix, which we're using a lot of now, or Coumadin, you have to be very careful because you could get a drastic decrease in your blood clotting ability, which could lead theoretically to a bleeding situation. Another interaction which I thought was extremely interesting is that we use thiazide diuretics a lot to treat high blood pressure or as a part of a regimen with other drugs to get blood pressure down. If you use ginkgo in conjunction with thiazides, it can actually elevate your blood pressure.
Oh my gosh. Gee.
So, you know, I think the point is that I don't expect our viewers tonight to remember all of these things, but I hope the point we get across is that if they're using these types of products, they need to start asking some questions.
Right.
And they need to be more free with the fact that they're taking these products.
Well, I want to cover at least one more. St. John's wort people, I guess, take for depression a lot.
Absolutely. And probably there's more information now about St. John's wort than there is with a lot of other drugs, and I think the reason that it's coming up is because St. John's wort is an enhancer of a metabolic pathway that many, many drugs are metabolized via in our body. So we're seeing a lot of drug interactions now with St. John's wort. One that's very significant is for people who are taking digoxin for heart control and function, heart rate control and function of their heart. St. John's wort can drastically decrease the blood levels of that drug. The blood levels of that drug are critical for proper functioning of that drug. So if you're going to start or stop St. John's wort and you're taking digoxin, you need to tell your physician so that he can do a dig level to make sure that you're getting an adequate amount of that drug.
Now there's a product called Kava. I'm not familiar with that. What is that one?
Kava is a drug which is used a lot for anxiety, tension, to help people sleep at night. It's been getting a lot of press. I can remember one article because a fellow got in an automobile accident because he had taken Kava, and there's this legal thing about was it substance abuse, blah, blah, blah. Well, Kava in conjunction with drugs like Valium, Xanax, Ativan, which we have a lot of people that are that take those types of drugs, can actually add to the CNS depression. There have been cases where people have become comatose from using those drugs in combination. Alcohol is definitely not a good mix with Kava. Kava is a safe herb if it's used appropriately, but not when it's mixed with other drugs like that.
Well, a lot of things we need to investigate here, and I certainly don't have all that information. You must keep track of a lot of these things.
I have just, at my pharmacy, installed a new computerized program that checks against people's drugs as I'm filling their prescriptions, to give me some information about possible interactions with herbs so that I can discuss this with them and find out, are you taking this and this and this
Great.
and this?
Really state-of-the-art. As usual, Medicine Shop is the forefront of modern pharmacy, and I appreciate that too.
Thank you.
Bob, as usual, very useful, very important and timely information, and I hope our viewers will discuss their use of herbs with their doctors and pharmacists before they consider mixing them with prescription medications. We look forward to you returning on Pharmacy Corner on future programs. Thank you.
You bet.
Now on with the Medical Explorer. On previous Medical Explorer programs during the past 18 years, we've seen a great deal of new technology from the doctors and staff of Sutter Buttes Imaging. We've watched and learned about early CT scanners, magnetic resonance scanners, mammography, ultrasound, osteoporosis bone scanners, and many other diagnostic techniques. Let's leave our Medical Explorer studio here at the Advanced Dermatology and Laser Center of Northern California and walk one whole block down Shasta Street as we return to Sutter Buttes Imaging. It's a true pleasure to return to Sutter Buttes Imaging. You know, it's nice to, when I work on these programs, to just walk a half a block down the street, and here we are at one of the most high-tech radiology imaging centers in the United States. And with me today is Dr. Phil Shelton, one of the board-certified radiologists here. Welcome to the Medical Explorer.
Well, thank you very much. Appreciate you coming by and seeing us here.
You know, years ago when I came to town in the early 80s, I felt I knew every doctor, but now there's so many people I don't know, and I'm sort of sad to say I haven't met you before, so maybe you could tell us and tell me at the same time how long you've been here and what type of training you were had and that sort of thing.
Okay. I've been in town here about just a little over a year. I was in the military before that. I was living in Washington, D.C. Originally from Northern California, kind of wanted to come home. I did my training at UC Davis down in Sacramento, finished there in '95. So,
in order to become a radiologist, you have to go through the grind of 4 years of college and 4 years of medical school, but then what happens after medical school?
After medical school, you have another 5 years of residency training beyond that. And then if you want to subspecialize, like some of the guys in the group in neuro or interventional or things like that, you're talking another year to 2 years. I tease my nieces and nephews about it. I said, yeah, I went to school for 25 years to get to where I was.
Let's first discuss exactly what a CT scan is. I mean, our viewers have seen things on television, but maybe you could just tell us about that.
Okay, a CT scan, basically all it stands for is just computed tomography. It's just like a regular X-ray machine, basically, except inside of it, on one side there's a beam where the X-ray is coming from, and the other side there's a detector, and that actually spins around together. And so as it's spinning through, it's sending X-rays to the patient and detecting them on the other side. And through the marvels of computers we have these days, it takes that information and makes an image. That's the basic bottom line of how a CT works.
And when these scanners first came out, I understand it was primarily doing heads, but now you can really do the whole body?
Oh, absolutely. We can do the whole bodies very easily with this scanner and very quickly, and that's one of the